Hello, this is Dr. Gary from First Look MRI, and this is a 49-year-old male who was in a motorcycle accident about a month ago. He went to his orthopedic surgeon with complaints of swelling and lateral pain, and the orthopedic surgeon did an exam in his office, which is right here. And on this view, we see the kneecap in the middle looking good. We see the femur here. And on this coronal view, we see lots of edema out here on the lateral side where he's having symptoms. Now in this axial sequence, if we go down a little bit, we see the lateral patellar retinaculum. It comes off the lateral patella, lateral kneecap here. It comes over, and this little band of tissue stops right here. And there's a hole down lower. We see bright signal here. This is fluid or hemorrhage going in between the torn fibers of the lateral retinaculum. So lateral retinacular tear down lower. As we keep on going down below the knee joint, we see some unusual signal back here. And we see this unusual area of bright signal here. This is edema or hemorrhage. It's right by the fibula. This is the tibia. This is the small bone, the fibula. We see all this abnormal signal here. This is fluid, which is probably related to hemorrhage over the lateral aspect of the joint. Now if we look on this coronal view, looking straight ahead, we see the femur, tibia, and let's try to find that fibula. Here's the fibula. And the fibula is unusual in that it's concave. Normally it has a rounded outer contour, but it's concave, and this is the donor site for a fracture fragment. This is the fracture fragment right here, distracted proximally. And this little horizontal shelf should be down here. And this biceps muscle, this conjoined tendon attached to this bone, and that little horizontal shelf here is the bony attachment of these. It's called the conjoined tendon. So this is a fluid-filled gap, a fluid or hemorrhage here, edema or hemorrhage filling the space, and that fracture fragment is distracted proximally. On this coronal protein density sequence with no fat suppression, the fluid and marrow are the same signal, so it doesn't stand out quite as well, but you can see this horizontal shelf, the periosteal attachment. You can see the fibular collateral ligament. Normally it's straight and taut, but now it's lax, kind of folded upon itself here. And this is the bony attachment. This is called the conjoined tendon. And this is the biceps muscle, biceps tendon, and then the conjoined tendon. Maybe a little bit of thickening there at the conjoined tendon attachment. Now there's a horizontal band of abnormal signal in the meniscus here, a tear within the substance of the meniscus. And we have one other finding, which is over here in the front of the femur. We'll put up this view, and we see that there is marrow edema in the anterior medial femoral condyle. So we know there's a bone bruise here. If we put up a sagittal view, looking in profile, we see that there is a bone bruise right here in the anterior medial femur. So we know that it's impacted with the tibia. And when that happens, it's because they have abnormal mechanics of force causing these two bones to impact together. So the tibia went medially. We call it a varus stress injury, and it went anteriorly. And when it went anteriorly, it impacted the anterior femur, and it distracted the lateral side. So as this medial joint got narrow and the bone impacted, the lateral joint widened, and there was distractive forces here on the lateral ligamentous structures, and it, instead of tearing this lateral ligamentous complex, it fractured the bone, and the bone drifted up. Most often we'll see injuries of the ligaments or muscles out here, and more rarely we'll see something like this where the muscle and tendon are strong, or ligaments are strong, and the bone is weaker, and it'll just shear off a piece of bone just like this. So in the end, we have a motorcycle accident causing a hyperextension varus stress injury with impaction medially, distraction laterally, and a bone avulsion fragment from the fibular head that's distracted proximally, and hemorrhage and fluid coming out here. And one other finding, which was in the back. This is an area of bright signal back here. This is the popliteus muscle belly. It's expanded and filled with fluid signal. So he has a high-grade tear of his muscle belly in the back here. Thank you very much.